Hi, everyone. So, this week we're going to be exploring narrative therapy and see how it's used as a brief therapy model. So, what is narrative therapy? Narrative therapy is a type of therapy that helps clients explore and reinterpret or restructure the stories they have told themselves throughout their lives. It teaches the client to be the expert of their own life and engage in a form of meaning making from their own stories. For example, narrative therapy is something that is utilized in different forms of trauma therapy, such as TFCBT, where a client is asked to write out a narrative of their trauma and restructure it to find meaning in the narrative, to identify resilience, and to rewrite their story as victim to survivor in some sense. This form of therapy is meant to be empowering by focusing on non self blaming and non judgmental approaches to understand and work through challenges of presenting problems. So, one unique characteristic of narrative therapy that makes it stand out from other therapy approaches is the use of externalization. Externalization is the process of helping create distance between a client and their problems. It allows for clients to focus on creating change in unwanted behaviors. So, you'll see the externalization process often play out through externalizing conversations. In these conversations, you're helping the client move away from self blaming, self attacking, and judgmental perceptions. You're helping trying to think of an example. So, for example, this might look like rephrasing a question of what has made you decide to stop going to your new school to how has the new school affected you? So as you can see, we're refocusing on the new school as what might be contributing to the presenting problem rather than highlighting and focusing on the client's lack of attending the new school. So in these externalizing conversations, you're also um, using the practice of mapping, which is identifying the influence the problem has on others, as well as the client's hopes, dreams, and values. You can help the externalization process by giving the problem its own unique name. So, for example, I worked with a child where we named their anger and frustration the hurt. So, when discussing her anger, we'd use phrases such as, how has the hurt presented itself this week? Another technique used in narrative therapy is deconstruction. It's the process of breaking down the ingrained and learned story a client has into smaller parts, clarifying the problem from there and working towards making the problem more approachable and again empowering the client. This in part is done by fully understanding the problem, such as understanding how the problem arose for the client and what contributed to the initial beliefs around the problem, for example. Another technique used is helping the client create an alternative story to their original one. The role a therapist utilizing narrative therapy is not only challenging the problems, but helping the client create meaning and view alternative stories to the problem itself. So this might look like, for example, helping a client who had been abused as a child shift their story to see themselves as not a victim, but a survivor and someone possible of overcoming difficult situations. The hopes of these techniques in narrative therapy is to help the client in eventually redefining themselves and their stories. So, narrative therapy can be utilized with any client struggling with overwhelmed negative thoughts and feelings, and who would benefit from viewing themselves as experts of their own lives. That being said, there is some evidence that points to narrative therapy being particularly helpful to people who struggle with anxiety, attachment issues, depression, ADHD, eating disorders, and PTSD or other trauma related disorders. So, narrative therapy is a great therapy model to use in a short format. When we look back at what makes a brief therapy brief, we identified three phases of change, right? So, including these include engagement, discrepancy, and consolidation. In the engagement phase, narrative therapy is highly collaborative and creates quick, deep, meaningful relationships between client and therapist. In the discrepancy phase, the narrative therapist identifies maladaptive behaviors and thinking patterns through the use of narrative stories and narrative techniques. The consolidation phase involves the brief therapist assisting the client in restructuring their stories, finding alternative stories, and establishing a new definition of themselves. It's a therapy that allows the client to see that they are the experts of their own lives and helping them become the primary agents of change. All right. And that's all for this week. And I will see you guys next week. Take care.